Hello. Thank you for taking the opportunity to view this brief video. My name is Allison Alfaro and I've been a nurse for 16 years. I'm currently pursuing a master's degree in nursing from Midwestern State University in Wichita Falls, Texas. Like you, I am also a parent, and as parents we strive to do what is best for our children. Many of us have heard recent news stories discussing the rise in drug-resistant infections and superbugs such as MRSA, also known as MRSA. The objective of this video is to discuss what we as parents can do to protect our children from drug-resistant infections. Antibiotics have been used since the 1940s to treat infectious diseases. Without the development of these powerful drugs, there would have been no cure for illnesses such as tuberculosis, typhoid fever, pneumonia, and even simple diseases such as strep throat. Unfortunately, the attitude of, if a little works, more is better, has been used with antibiotics. And now, because of that attitude, some bacteria have grown resistant to the same medications that once cured them. Can you imagine what would happen if the bacteria that caused strep throat became resistant to treatment? The truth is, we are seeing a rise in resistant strep infections. Penicillin, which is considered the gold standard for the treatment of strep throat infections, has become ineffective in up to half the cases of strep, meaning that stronger, more potent antibiotics must be used. Drug resistance has the potential of making what seems like a minor illness become a life-threatening illness requiring prolonged hospitalization. According to the Centers for Disease Control and Prevention, people infected with drug-resistant organisms are more likely to have longer and more expensive hospital stays and may be more likely to die as a result of their infection. When the drug of choice for treating their infection doesn't work, they require treatment with second or third choice drugs that may be less effective, more toxic, and more expensive. This means that patients with a resistant infection may suffer more and pay more for treatment. So what has contributed to the rise in resistance? Well, number one is misuse of antibiotics. Many times people stop taking their antibiotics because they feel better and they want to save the rest for later. The problem with saving them for later is that you haven't completely treated your infection. The bacteria that are left behind can then reinfect you, you can spread them to others, and they can develop a resistance to the drug that you were prescribed. Overuse is the biggest reason for drug resistance. Antibiotics treat only bacterial infections. They don't treat viral or allergic conditions. All too frequently, when we have a cough, a sore throat, runny nose, nasal congestion, we run to the doctor for our magic cure, believing that an antibiotic will make it all better. Most of the time, these symptoms we are having are the result from allergies or viral illnesses such as the common cold or the flu. In 1992, the Centers for Disease Control and Prevention outlined 5 respiratory conditions for which antibiotics were not needed, but accounted for 75% of all office-based prescribing for all ages. They included ear infections, sinus infections, bronchitis, sore throat, and the common cold. Most of the time, these illnesses will resolve on their own. These conditions do make us feel lousy, and that's the reason we seek out treatment, is because we want to feel better. But you can feel better without antibiotics. All of these conditions can be treated symptomatically. The nagging cough of bronchitis can be treated with cough suppressants, inhaled steroids, which decrease inflammation, thus reducing the cough. The headache, ear fullness, and bothersome nasal congestion associated with sinus infection can be treated with sinus rinses, decongestants, and nasal steroids, or even systemic steroids to treat inflammation. The pain associated with viral throat infections and ear infections can be treated with pain relievers such as Tylenol and ibuprofen. Numbing ear drops and numbing swish and swallow solutions can also be used. With intense pain, medications with codeine, such as Tylenol No. 3, can also be used. So what can you as a parent do? Well, according to the CDC, discuss treatment options with your provider. Ask your provider if the illness can be treated symptomatically, or if antibiotics are really needed. Most providers are more than willing to treat symptomatically. In fact, studies have shown that prescribers often only give antibiotics because they feel the patient wants an antibiotic, not because it's a necessity. Don't take an antibiotic for viral conditions such as the cold or flu. Don't save your antibiotics for later, for the next time you get sick. Take the antibiotic exactly as the health care provider tells you. Don't skip doses and complete the prescribed course of treatment even when you're feeling better. Do not take antibiotics prescribed for someone else. The antibiotic may not be appropriate for your illness. Taking the wrong medicine may delay correct treatment and allow bacteria to multiply. If your healthcare provider determines that you do not have a bacterial infection, ask about ways to relieve your symptoms. Thank you for taking the time to view this video. I hope you've learned a little bit about drug resistance. For more information on drug resistance and what you can do to combat this growing problem, please visit the CDC's website at www.cdc.gov/getsmart. And for more information about Midwestern State University, please go to www.mwsu.edu. Thank you.